Well, there was some quite worrying accusations made by certain members of staff and past members of staff who went to the media. As minister, I take any such accusations extremely seriously, and they must be investigated. In this instance, we decided that the best way to do that was to have a completely independent report. Dr. Dickinson, who's been over and reviewed our services previously, very kindly agreed to come back over and do so again. So he already had that base of knowledge about what we deliver on the island and how we deliver it, which is exceptionally helpful when bringing any of these things forward. And he came over, did the review, and the review is now available. The department has published the review in full today, and so anyone can go on and read it in a completely open and transparent way.
Is it a bit disappointing that staff members would take concerns to the media rather than to the department?
I mean, obviously, that it is sad that the members of staff felt that way, that they had to go to the media. Certainly, it's not a culture I want to see embedded in the department. I would much rather people felt comfortable raising issues with their line managers and also via the government whistleblowing policy, because that's there for a reason, and that people should have confidence that any such claims through either of those routes will be investigated accordingly. And that's a culture that I want to see embedded in the department, where people feel they have the confidence to use those appropriate mechanisms.
Now, as you say, Dr. Dickinson has done reports on the island before. How many visits did he make to actually put this report together?
Well, he's been working constantly over the last 5 months or so. I was working it back earlier on today. It's been about 5 months in compiling this. So he's been speaking to staff. He's also been speaking to patients as well. He's been talking to all those who utilise the service to try and build a picture. So as you will see from the report, it's quite a comprehensive report with some very comprehensive recommendations as well.
Is it quite helpful having someone who's seen the previous facility as well so that he can make those comparisons?
I think it is, because he's been able to draw out those comparisons. So although there's certain things he's found that we need to improve on, and we're certainly not going to shy away from that, we're accepting all 17 recommendations he makes in the report, he also identifies some things he believes have radically improved since his last visit and his last report, namely around the environment, which he says Manannan Court's environment is much more fit for purpose than Greenwich Court's was. Patient safety is much more of a priority. He recognises the good practice in the development of the ward manager roles. He also welcomes the suicide prevention policies that the department has put in place, and he absolutely praises the integrated care project, which he says is an absolutely excellent development.
Well, as you say, there are some recommendations for improvement. One of those areas is the care plans, which have been labelled poor and in need of some urgent improvement. How concerning is that?
For me as Minister, that's exceptionally concerning. In terms of care plans, there does need to be some urgent improvement. One of the big things that Dr. Dickinson identified there was we need to engage more with patients to give them ownership within their own care plans. And care plans should be something that involve the patient so they've got buy-in, rather than just being something that's done to a patient. And I think that comes very, very clearly out of Dr. Dickinson's report. And like I say, the department accepts all 17 recommendations. Most of the stuff within those recommendations are process and procedure changes, which the department can quite easily do. And I believe now we should be working full steam ahead to deliver on those recommendations.
So when will these improved care plans be in place?
Well, we should be working on it from now, from day one. What's important with care plans is you take the time to ensure it's right for the patient. Care plans have to be individualised, because the whole point is it's what suits that patient. You can't just have a broad brush, a stroke across where it just applies to everyone. It's got to be individualised to the individual patient, and the procedures on how we engage with the patients over that will be starting to be advanced from day one, which is today.
There was talk as well about implementing physical healthcare plans for every patient. How important is that connection between mental health and physical health?
From my point of view, personally, very, because it's something I've been banging on about for a long time, and I was banging on about before I was Minister for Health and Social Care when I was a backbencher. There is an inextricable link between mental health and physical health. You can't separate out the two. They've got to be looked at in conjunction. So again, I agree with what Dr. Dickinson said, where the two are linked and they need to be developed side by side. And again, that's something the department needs to improve on and work towards.
Another area that he raised a bit of concern over was the lack of progress on the Safe Woods model. What is that?
So in terms of the Safe Woods model, he believes that it's actually stalled. So the Safe Woods model is a bit the best way to actually describe it is it's in relation to the way that wards are dealt with. So the how you deal with conflict is probably the best way of putting it in layman's terms. How you deal with conflicts arising between the patients and those pressures within the wards. So how you de-escalate things and how you ensure that the patient feels confident they're in a secure environment, that they're being treated appropriately, and you don't end up with this constant feeling of conflict. He didn't say it hadn't, he said it had stalled, was the exact words he used. And again, it's something we should be working towards to ensure that relationship conflict training is appropriate in there.
Why has it stalled?
I actually don't know the answer to that. The first I've seen of it is in the report from Dr. Dickinson. I've been learning about the model myself, actually. The Safe Word model was pretty new to me as a layman politician, and about how it deals with relationship conflict and everything else. I assume, to be perfectly blunt, it is probably stalled because of the changeover to Manannan Court and the fact there's been more pressing things around the organisation of the wards and staffing of those wards.
Well, looking at the staff in Manannan Court, Dr. Dickinson raised the idea that some have a pejorative attitude towards those with personality disorder. That surely can't be acceptable if you're working in mental health.
Yeah, it's a cultural thing, and it's very important that we have staff that are sympathetic to a patient's needs. Certain people, depending upon their condition, obviously can come across as difficult patients, but it's important that people understand the particular problems of that individual. We're all human and we're all unique. No two patients are the same, and it's important that we do endear a culture within the staff management and care on the ground that is caring, compassionate, and able to understand the unique needs of each individual patient.
So what work is actually being done then to make sure that staff do understand those individual needs?
So there will be appropriate training put in place in line with Dr. Dickinson's recommendations. And like I say, we'll be working towards that right now from day one.
There was also the issue of staff being on the same ward for a number of years. There seems to be this theory that rotating staff is beneficial. Is that something that you're going to be keen to bring in?
Again, I found that quite interesting in the report that Dr. Dickinson highlighted. He felt that rotation was a good thing. He highlighted in the report as well, of course, instances of where staff had rotated, and he says they're absolutely excelling, I think, or words to that effect, that they're flourishing in their new roles. So I think it is something the department should look at to see where practically possible, if, we can change people's roles round and it's not going to cause too much upset or problems for the individual, that we should be able to bring people up to the challenge of doing that.
Well, you mentioned their disruption to the individual. There were some concerns about a staff rota and some changes to staffing hours. How important is it to actually keep the staff happy?
Well, there has to be a balance at the end of the day. Dr. Dickinson in the report identifies, as was identified in the media from the people who were unhappy with the new rota system. But as the report comes across and actually basically says, it seems to be certain members of staff. It's certainly not the whole group of staff. And you do have to balance the rota needs with the staff needs as well. So there is that balance to be met. We've still got a service to run. And my understanding, certainly from certain members of staff I've spoken to, they're quite happy with the rota system in place. And again, within the report, Dr. Dickinson seems to identify it seems to be a certain group of individual staff. But if they've got concerns, as the report states, they have been asked if they can come up with alternatives that work better, please bring them forward. And we're open to listening to that.
So the report mentions a clinical psychologist who comes in to do sessions, and that there's been poor attendance for those sessions. Is it a bit disappointing to hear that?
I'm going to say I did find that a bit disappointing. Again, I can understand with pressures of work and of shifts and demand that on people's time can become very precious. and suddenly these sessions that sometimes you can have lots of different sessions of things to be doing get pushed to the back of people's mind, and they think, oh no, it's more important I focus on the day job. But I think, again, we need to endear a culture of saying to people, no, these sessions are just as important, and it is important that you attend. But equally, as a department, we need to be facilitating people to attend. So we should be actively encouraging and giving people the time, because I know certainly not necessarily in public sector since I've been in MHK, but my previous life in private sector, I know sometimes it's been cases of there's been pressures at work, so a business has stopped someone going on a course or something like that. I think it's important we facilitate it and we give people that time to be able to attend sessions.
There seemed to be a suggestion within the report that staff didn't seem to think it would be as beneficial as Dr. Dickinson did. Which one do you think is right?
Well, again, I think it's getting over that cynicism with people and saying, look, go along and, try it. Go, the course, Dr. Dickinson feels the course is of benefit. We'll take a look at that. And, clearly it's being provided. And I would like to see decent attendance at the course, unless people can give me a very good reason as to why it isn't of any value, in which case my question would be, why are we running them in the first place? So there must be a reason we're running them, and it sounds, from certainly what Dr. Dickinson's put in the report, he believes they are of good value, so we should be trying to encourage attendance.
As we've touched on already, the report does mention that there have been a lot of improvements since moving to Manannan Court. Are you confident that things are all now heading in the right direction?
I think things are heading in the right direction. As with any organisation, health and social care, there's going to be pressures. I'm not going to sit here and try and pretend the world is always going to be wonderful and everything's going to be completely right. There's always going to be pressures across the health and social care sector. There's from staffing pressures to budgetary pressures, but what's important is that we keep the patient as the focus in everything that's done, and that, I believe, is what we're doing. Dr. Dickinson, as I say, has identified that the environment is a lot better. He's mentioned about the suicide prevention policy. He's talked about the way the ward managers now work. So there's certainly some huge big changes that have happened since he was last here 4 or 5 years ago that he recognises is exceptionally positive. So that's not trying to belittle the things like the care plans and the 17 recommendations that we do need to urgently work on, but it's also to recognise it was a balanced report and there's a lot of good praise in there as well.
The Harbour Suite, that was described as chronically over-occupied in one bit of the report. It's still quite a new facility, Manannan Court. Is it concerning that possibly it's already being stretched?
Well, that was a reference, obviously, from the Mental Health Commission, I think, that Dr. Dickinson was quoting from one of their review reports. My understanding is the average occupancy at Harbour Suite is around about 83%. In fact, I answered a Tim Ward question on this about I think it might have been June or July's sitting. So our average occupancy is around about 83%. There can be occasions where we've got people in under observation, which Dr. Dickinson identifies in the report, where he says that staffing, if there's a certain number, I think it's more than 2, under intense observation, there needs to be increased staffing. And that's something that forms one of his recommendations that we will be looking at.
And what happens next? Are there going to be more of these reviews? Is there a plan to do reviews on a regular basis to keep on top of this?
You can end up reviewing yourself to death, to be perfectly honest. I think with health and social care over the last 10 years or so, that's certainly what we've done. I opened the nursing conference last week, and I think there was a feeling amongst staff there that, there's review fatigue. They've had the Sir Jonathan Michael review. Now in mental health we've had this. What's actually important is that we act on the recommendations. We've got a report, we've got 17 recommendations. The crucial thing is bringing those 17 recommendations in, not just continuously going back and reviewing and reviewing and reviewing.
Is there going to be a fixed timeline for bringing in those recommendations?
Well, that will now need to be worked on. Obviously the report has gone public today. There will now need to be sat down an actual timeline as to when the individual recommendations can be brought forward, and an action plan as to how each of those recommendations progresses. Things need to be done in a joined up manner. There's too many times, if you go back over previous government administrations, where reports have come out with recommendations and people have just said, oh yes, we'll just do it by X date, without actually having sat down and planned out how it's going to be done. Particularly when dealing with patients, things need to be done in a structured way, and that's what will be happening now.
And just finally, have you had any reaction from staff to this report?
I personally haven't as yet. It was shared with the staff this morning ahead of the public publication of it. I personally to date haven't had any feedback. I'm sure I will have over the next few days. And that's the key thing with all of these recommendations in any review, that we engage with staff on the ground, understand their position, and get their buy-in on the changes that need to be made, because at the end of the day, they're the people delivering the service on the ground. They're the people who know what works, what doesn't, and we should be engaging that knowledge base in order to implement these 17 recommendations.